Good morning. Thank you for joining us for our webinar, which kicks off the first phase of consultations to support planning for Ryerson's proposed School of Medicine. I'm Marcia Moshe, a professor in the Department of Psychology and Vice Chair of the Ryerson School of Medicine Planning Committee. Before we begin, I just want to go over a few housekeeping items. This presentation is set up as a webinar. That means that your camera and microphone can't be turned on. We're recording this presentation to make it available to those who are unable to be here this morning. But that recording will only capture the presenters, the slides, and Kathy Monroe, who is providing ASL interpretation. We also have live closed captioning. You can turn it on by toggling the CC button in the bottom right corner of your Zoom window. As you know, technical difficulties can't always be prevented. So if you find yourself disconnected, rest assured that we are recording this presentation and it will be made available. And if one of us gets disconnected, please be patient and bear with us. We now begin the webinar with the land acknowledgement. Toronto is in the dish with one spoon territory. The dish with one spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. For today's webinar, President Mohamed Lachemi is going to begin the session by providing context for the proposed Ryerson School of Medicine. Vice President Research and Innovation, Stephen Liss, will provide an overview of the proposal development process. Then we'll spend about 20 minutes inviting President Lachemi and Vice President Liss to respond to pre-submitted questions from the Ryerson community. We'll end by sharing information about other ways that you can take part in the first phase of consultations. Now, it's my great pleasure to welcome Mohamed Lachemi, President and Vice Chancellor of Ryerson University.
Thank you very much, Marcia. Good morning, all, and thank you for joining us. A few months ago, we launched our strategic vision for Ryerson to the year 2030. It calls for our university to be unapologetically bold, and for our students, faculty, and staff to be agents of positive change. In keeping with that vision, I'm excited to be talking to you today about Ryerson's proposal for a medical school. Healthcare is one of society's most pressing challenges. By applying our expertise and engaging with partners, we can improve lives in our neighborhoods, in our province, and around the world. This is a once-in-a-generation opportunity for Ryerson. Today, we want to hear from you. Your input is vital to shaping our proposal. First, some background. The province has provided $1 million to develop a business case for a medical school. Why is the government interested in a new medical school for Ontario? In large part because of the pandemic. COVID has exposed the weaknesses in our health system. Weaknesses like issues around equity and access to care, particularly in underserved areas. Also, lack of innovation and technology that helps patients sooner. Each of us has firsthand experience with our health system. We know there are dedicated people working very hard to serve patients. But many aspects of our system can be improved. A medical school with an innovative approach can help change our system for the better. It's about transforming the system. And a transformed system will require a new kind of doctor. You may ask the question, why Ryerson? Ryerson is well positioned to build and support transformation in healthcare. We are known for innovation in curriculum and in practice. We attract talent from diverse communities. We focus on culturally respectful approaches. We have established our commitment to meeting local needs and embedding it in a professional practice. Most importantly, we have a history at looking at problems differently and challenging the status quo. So why Brampton? Brampton is one of the fast-growing cities in Canada, largely due to immigration. As a result, it is underserved in healthcare. We see that with COVID-19 and the high rates of occurrence there and in the Peel region. Ryerson and Brampton work well together. We know each other. We have a history of partnering successfully. Examples, Rogers Cybersecure Catalyst, Brampton Venture Zones, and more to come. This is not about creating a traditional medical school. Ryerson can offer a new approach to medical education in Ontario, one that fills significant gaps. Our School of Medicine will be committed to focusing on community-centered primary care and social factors that determine health, providing more culturally competent care to communities, using technology and innovation to identify and address health issues sooner and more effectively, providing future doctors with the skills to work in networks of healthcare for better patient outcomes, and focusing on supporting seniors as our aging population grows. We know how to get this done. Our expertise is known in many aspects. We are known for excellence in healthcare education and research across many faculties and departments. Among them, psychology, nursing, midwifery, occupational health and safety, social work, public health, urban health, biomedical engineering, biology and chemistry, and medical physics. We have strength in research too. Our researchers are making their mark in areas such as molecular biology, biomedical devices, and digital systems and data, and with the social determinants of health. The School of Medicine will build on the foundation of excellence and leadership in both health education and research. And we have long-standing and productive partnerships in healthcare. With Unity Health and St. Mark's Hospital, for example, including labs in the hospital's research wing. We have IBEST, the Institute of Biomedical Engineering, Science and Technology, and the Biomedical Zone. These are two examples of successful collaborations on innovation. And we are home to the National Institute of Aging and the internationally trained medical doctors bridging program at the Cheng School. What would a medical school mean for Ryerson? It will move our university to a new and exciting level of service. The benefits go far beyond Brampton, the Peel region, and the GTA. It opens opportunities to play a wide role in our community and the world. It creates learning and career opportunities for our faculty, staff, alumni, future students, and graduates. And it helps us fulfill our mission and vision in a new and exciting way.
Thank you, President Lashemy. Now it's my pleasure to welcome Stephen Liss, Vice President of Research and Innovation and Chair of the Ryerson School of Medicine Planning Committee.
Well, thank you very much, Marcia, and it's a pleasure to be here this morning. I am particularly excited and I'm honored to serve as chair of the Planning Committee for this exciting initiative. Building on Ryerson's SRC health strategy, the proposed Ryerson School of Medicine will lend itself to community-based care, while at the same time in preparing a diverse network of future healthcare professionals for health challenges of tomorrow. As the President has explained, COVID exposed the existing weaknesses in our current healthcare model. There is no argument that Ontario needs more doctors to care for its growing, diverse population. With the development of the proposed School of Medicine, we have an opportunity to bring new approaches to tackle complex challenges, such as the failure of long-term care homes, all in a way that is culturally sensitive and respectful. COVID has also taught us that we need more collaboration with communities and between health professionals to create a robust, integrated primary care model, especially when considering the sustained adoption of virtual care. Brampton presents an opportunity for Ryerson to address a real need for the city in regards to healthcare, and healthcare in Brampton has been notably underfunded, and the city and its residents have actively pushed for a fair deal for healthcare in their community. This new medical school will not only build on the healthcare system in the city of Brampton, but also create space for a diverse pool of talent to thrive in the healthcare sector. Planning for a School of Medicine is an exciting, ambitious, and challenging endeavor, and it will take years to realize. The planning will be a multi-year journey with many opportunities to listen, learn, and co-create. To start us on the first stage of this journey, today, I will provide a short overview of the Planning Committee structure, consultation next steps, and the way that you can participate in this first stage of the planning process. Ryerson is a community builder with extensive experience working within communities to solve societal problems and reshape the future. The curriculum and scholarly research and creative activities for Ryerson Medical School will be community engaged and mindful of the social determinants of health. Ryerson is well positioned to promote models of care that integrate hospitals and community networks more effectively through its educational initiatives with allied health professionals. When developing community-based programs, we appreciate the need to center the experiences of individuals, families, and communities from the beginning. And that is why ongoing consultation and engagement with stakeholders and partners will be a core component of the proposed planning and development process. Consultations will be iterative and ongoing. And each stage of the proposal development process will integrate consultation and consultations and will build on one another. Today's webinar is the kickoff of our first phase of consultations with Ryerson students, faculty, staff, and alumni to share information with the community about the planning process, to learn from your questions and concerns and develop a shared vision for the future of healthcare education and delivery in our communities. In this initial consultation stage, we want to ensure that the proposed School of Medicine aligns with the university's values, goals, and priorities. The feedback generated from the initial internal consultation process will be captured in What We Heard report that will be shared with the Planning Committee and will inform future consultations and planning. We will also share a synthesis of feedback from the questionnaire on our website. The creation of a new School of Medicine impacts all aspects of the university, and in recognition of that, we have formed a School of Medicine Planning Committee that consists of a broad representation from across the institution, including all faculties, as well as the administrative offices to guide Ryerson's approach to the proposal development in a strategic and coordinated manner. The coordination is especially important given the focus of the proposed School of Medicine on a community-based care. The Planning Committee is guided by terms of reference and is following Senate and Board of Governors decision-making and approval processes, including Senate Policy 112, which governs the development of new graduate and undergraduate programs. The Planning Committee will oversee the process for the School of Medicine development, consultation, and approval to ensure that the university is making coordinated decisions for the program, development, resource allocation, and external regulatory compliance. The Planning Committee serves as a committee of the whole, with members participating on subcommittees that will operate in parallel. And this structure will allow us to move forward quickly, but strategically to engage partners, develop the proposed curriculum and academic program, and create a comprehensive business case. The Planning Committee is an advisory committee that provides strategic guidance, counsel, and input into the approval process as unrelated documents. It meets twice each semester to receive updates from and provide guidance to subcommittees on potential issues and elements to consider in their deliberations and report creation. The Planning Committee will work together with partners and Ryerson University and Brampton community members to design a School of Medicine that is in line with Ryerson values to serve societal need, with an intentional approach to equity, diversity, and inclusion, and the goal of improving access. To fulfill its ambitions of establishing a new School of Medicine, the Planning Committee will have 4 dedicated subcommittees that will operate in parallel to complete the essential components of the required approval process, including Academic Program Development Committee, which will lead the drafting of the letter of intent and be responsible for creating all required curriculum and reports materials for Ryerson Senate and the associated quality assurance councils and regulatory bodies. The Feasibility Study Committee, which will conduct a feasibility study that includes a review of the financial, space, and resource requirements, will be important for a new School of Medicine, including the creation of recommendations report to the Board of Governors. Partnerships and Community Relations Committee will oversee government relations and strengthen Ryerson's community ties in Brampton, as well as with potential partners. The Executive Steering Committee, that consists of the respective executive group of the university, will meet bi-weekly to share information and monitor progress. This first phase of consultations will run from now to June 18th. There are 2 ways the community members can participate. The first is to complete an online questionnaire, and the second is to attend the Zoom community engagement. The online questionnaire is open to all members of the Ryerson University community. This anonymous questionnaire is made up of 10 multiple choice and open-ended questions about your thoughts on a proposed School of Medicine. You may answer as many or as few questions as you wish, and the questionnaire should take you no longer than 10 to 15 minutes to complete. The questionnaire also includes a number of optional demographic questions. These questions are included to help ensure we are reaching a breadth of the community members. The questionnaire will be going live today being April 23rd, and will close on June 18th. We value your frank input and are excited to receive comments and feedback from the community. I will also be hosting weekly 1-hour sessions via Zoom from May 6th to June 14th for the Ryerson community. A total of 6 community engagement sessions will be held over the course of the spring, and the dates and times are displayed on the slide in front of you. In these 1-hour sessions, I will provide an overview of the planning process and vision of the School of Medicine using interactive technology, and participants will be invited to share their feedback in real time, and there will be an opportunity for questions and answers. Please consider registering to attend one of the sessions via the Google form on our website. Accessibility arrangements will be made to ensure all are able to participate in the engagement, and please reach out to us at medicine@ryerson.ca if you have any questions. As part of these initial consultations, we will also be holding a Senate Committee of the Whole discussion before the May Senate meeting. The Board of Governors will be engaged as part of their annual retreat later this spring. While the pandemic prevents us from gathering in person, it also provides us with unique opportunities to connect more broadly and engage online. During this initial consultation phase, we have designed engagement tools to be inclusive of people wherever they are and have made them available for an extended 2-month period to recognize how busy everyone is. We are excited to see the Ryerson community's readiness to engage in the planning process for the School of Medicine. I want to thank you for joining us today. We will hope you will consider staying involved by taking part in the questionnaire and the weekly sessions, and by spreading the word about this consultation within your networks. Thank you.
Thank you very much, Stephen, for that summary. On April 14th, we invited Ryerson community members to submit questions in advance of this Q&A. It was really exciting to see the enthusiastic and thoughtful queries and comments you shared. Given the number of submissions, we selected the most frequently asked questions. Although we can't respond to all your questions today, we will do our best in the coming weeks to address these questions through our website and upcoming community forums and engagements. I will read the question and invite President Lashmi and Dr. List to respond. The most frequently asked question was, when should the school be completed and when can students apply? Mohammed, would you like to respond?
We are delighted by the interest in Ryerson's proposed School of Medicine. Planning for a medical school will be a multi-year process. We expect that the development of the full plan for the medical school will take between 1 year and 2 years. After the plan is developed, there are multiple steps to obtain approvals and accreditation. And first class will likely follow about a year to 2 years after full approval from the province. So assuming that things move along as we have planned, we could be looking at the first class in about 4 to 5 years from now.
Thank you, Mohammed. Students in particular were interested in learning more about the proposed admissions process. 3 questions were commonly asked. First, what will be the requirements, prerequisites, GPA for enrollment? Second, will the MCAT be one of the deciding factors for admission? And third, what will be the number of seats available for the medical school? Stephen, would you like to respond?
We greatly appreciate the interest from students who would like to find entrance into a medical program and learn more about the proposed admission processes. We're in the very early stages of our planning. Admissions criteria is not yet established. Decisions such as admission criteria and programming will be overseen by the Academic Program Development Committee and will be based on a comprehensive review of existing and emerging practices in medical school admissions, and will also integrate community feedback. There are a number of factors that go into determining the number of students that will be admitted into a school of medicine. And while no decisions have been made, we're hoping for a class size of somewhere between 75 and 125 students in the inaugural year.
Thank you, Stephen. A community member who is also a practicing physician inquired, will Ryerson's MD admissions process include a strategy to attract and support Black applicants, as well as a process to address the inherent biases in predominantly white admission committees that have led to lower rates of Black MD student admission in other programs historically? Mohammed, could you please respond?
Thank you very much for the question. I appreciate you taking the time to share with us your experience as a physician and your observations about admission and evaluation practices at medical schools. Diversity, equity, and inclusion are core values for Ryerson, and we will be taking a systems approach to apply an EDI lens to all aspects of the proposed School of Medicine, including admissions. The University of Toronto has been doing very thoughtful, important work around diversity, equity, and inclusion in medical training. For instance, through programs like Community of Support Program and their summer mentorship program for high school students of Indigenous and African descent. There are many promising and innovative policies, practices, and programs at peer institutions for us to learn from. Our academic program development committee is undertaking an external review of practices in other institutions, as well as research published on best practices for inclusive medical school admissions requirements and processes. This will also include a review of promising programs to address barriers that may prevent some young people from considering careers as medical doctors, as well as systemic support for racialized students after admission to help with their success during school and after graduation. And we have just begun the foundational work to ensure that Ryerson's approach to School of Medicine will be inclusive and robust in reflecting the changing healthcare needs of our communities.
Thank you very much, Mohammed. In thinking about what we can learn from other institutions, I'd like to move on to a question we received from a staff member who asked, the existing Ontario medical schools may resist the development of a new medical school, seeing it as a threat, an investment in provincial funding that comes at their expense. What can Ryerson do to respond to those fears, or even make allies of other medical programs in a shared mission of expanding medical education versus a competitive environment? Stephen, I'll ask you to please respond to this question.
Thank you, Marcia. I appreciate the opportunity to share a little more about our approach to developing the proposed School of Medicine. We believe that Ryerson can offer a new and complementary approach to medical education in Ontario, and one that draws on the university's commitment to community, diversity, and inclusion, and innovation to address the changing needs for healthcare delivery and practice. The COVID-19 pandemic has exposed and amplified the structural weaknesses and equities in Ontario's current approach to healthcare and need for systemic transformation to improve access to care, and particularly in underserved areas. A medical school at Ryerson would focus on primary care, offered expanded use of technology to better meet patient needs, focus on interprofessional practice, and prioritize culturally sensitive and respectful medicine, provided by an expansive commitment to equity, diversity, and inclusion. Our hope is that we will be complementary to what is offered by existing schools. Collaboration will be essential to the success of the proposed School of Medicine. As we have seen with the global fight against COVID-19, collaboration is key to addressing complex global challenges. We have seen researchers collaborate across diverse fields to address the direct and indirect effects of the crisis. Universities have combined expertise and are working with healthcare providers and commercial partners. The bonds we have forged with hospitals, industry, municipalities, community organizations, and other academic institutions have enabled members of our scholarly research and creative enterprise to establish rapid responses to the most key issues. We hope that the spirit of collaboration will continue.
Building on that theme of collaboration and the importance of expanding opportunities, our next question is from a student who asked, how will the quality of existing education programs at Ryerson be maintained or improved in light of another major expansion? How will quality assurance programs be scaled to meet the needs of a new faculty? I'll ask Mohammed to respond, please.
Thank you, Marcia. Ryerson Senate oversees the policies and processes that are used to maintain and improve the quality of both current and proposed academic programs. As part of our ongoing commitment to offer undergraduate and graduate programs of high academic quality, Ryerson has developed an institutional quality assurance process which adheres to the quality assurance framework established by the Quality Council. For the proposed new School of Medicine, we will be working through Ryerson Senate and following Policy 112, which governs the development of new graduate and undergraduate programs. In addition to institutional approvals, Canadian medical schools also go through a very rigorous accreditation process that is overseen by the Committee on Accreditation of Canadian Medical Schools.
Thank you very much, Mohammed. The next area that we'll focus on is curriculum development. We had a few students ask about our intentions for the program and whether it would be a 3-year program or a 4-year program. Here is one of the questions. What is your stance in regards to a 3-year MD program, such as that offered at McMaster and at other medical schools in the United States? Stephen, I'll invite you to answer this question.
The foundational curriculum in research at Ryerson School of Medicine will be community engaged and driven by a social determinants of health framework as central to healthcare delivery. We are exploring a 3-year MD program, such as the one offered at McMaster University. We're also exploring a fast-track program for foreign-trained professionals. Decisions such as programming will be overseen by the Academic Program Development Committee, and there's much to still learn, consider, and determine with respect to the framework of our program and whether a 3-year program is suitable. Thank you.
Thank you, Stephen. I have another question that we received from a faculty member who inquired, how will the proposed School of Medicine integrate and leverage in its very foundation a broad base of disciplines in the humanities and social sciences that intersect with human health, such as Black studies, communications, English, gender and sexuality studies, history, Indigenous studies, philosophy and bioethics, science and technology studies, and sociology, and to accord to those disciplines some decision-making power to guide the school's research agendas and curriculum. Stephen, I'll ask you to also respond to this one, please.
So thank you, Marcia. Ryerson is fortunate to have faculty and students working in the humanities and social sciences, and particularly in areas that are focused on healthcare and medicine, and who are making important contributions to our understanding of health and well-being, including issues around health equity. We've shared the curriculum development in its earliest and most exploratory stage at this point in time. The multidisciplinary committee overseeing the review of best practices and current trends include faculty and community members, drawing from expertise from across the university. As the committee begins identifying priority directions, they will be encouraged to invite experts from a broad base of disciplines to contribute to their process, and will be seeking and integrating the feedback from the community consultations, including the humanities and social sciences.
Our next question relates to the relationships that will need to be established to support a School of Medicine. We have had a student ask, what hospitals will be used for clinical studies in upper years of medical school? Will the downtown Toronto hospitals be considered, even if the school is in Brampton? And what do you think of more medical school graduates and the number of residency spots available in Toronto? How will the new school affect it? Mohammed, could you please respond?
Thank you, Marcia. We are in discussions with a number of potential partners in Brampton, in the Peel region and beyond. And we are investigating different models that could be used for clinical studies. Since the proposed focus of the School of Medicine is on primary care, we are interested in exploring different types of placements and residency spots, such as in the long-term care homes and other community-based settings. We're very early in the planning processes, but we are aware that as additional spots in medical schools are added, there also needs to be an increase in the number of residency spots available.
To follow up on that question, we had a faculty member indicate that they're interested in learning more about plans for involvement of public health and population health in proposed training. Stephen, I'll ask you to please respond.
Thank you, Marcia. While curriculum development is just beginning, we imagine opportunities to build on Ryerson's existing strengths in public and population health, and fields like epidemiology and health promotion to support healthcare training programs. Integrating a social determinants of health perspective in training has emerged as an early priority, particularly in the context of community health.
Thank you, Stephen. And that brings us to our final series of questions. We had both staff and students ask how they could contribute to the development of the proposed School of Medicine. Here are some of their questions. These new and rare projects, as discussed in Senate, may open up opportunities for staff to engage and contribute to the university. How can this happen? How can current Ryerson University students help the process of establishing the School of Medicine? Mohammed, would you like to take the final question, please?
Sure, we are grateful for the interest and support in the planning for proposed School of Medicine. As I shared at the beginning, planning for the School of Medicine will be a multi-year journey with many opportunities to listen, learn, and co-create. We value input and are excited to receive comments and feedback from the community. For this initial stage of consultation, I encourage you to please participate in the process, complete the online questionnaire, and consider attending one of the weekly engagement sessions. Help shape this next exciting chapter in Ryerson's history by sharing your perspectives and questions with us. As Stephen indicated, this is the first of many consultations. We will share the feedback of what we have learned, and we also promote additional opportunities for you to become involved as planning progresses. And this is your school, and we want you to be part of it. Thank you.
Thank you for joining us for the first of many upcoming consultations. I'm now going to invite President Lashany to share some closing thoughts.
Thanks to everyone for participating. I hope this webinar has been helpful. I encourage you to visit the Ryerson School of Medicine webpage for more information, schedule of future consultations, how to engage us online. This is an exciting time for Ryerson. The most successful organizations are always in motion. Aiming for a medical school is our next big step forward. The opportunity is in front of us to shape a new future for our university. Please stay connected and watch the updates on our proposal. And thank you for being part of this journey.
Thank you, President Lashany. As we indicated before, we just launched a consultation questionnaire. I do hope that you share any comments, questions, or reflections from today's webinar in the questionnaire. We're also hosting a number of smaller upcoming consultations for the Ryerson community. You can register at the proposal development website for the School of Medicine, which is on the slide. Thank you again for your time and your contribution to this important conversation. Have a great day.